So again, welcome everyone. My name is Suzanne York, and I'm the Director of Transition Earth. We're a small nonprofit in California. I want to give a big thank you and shout out to Population Connection for hosting this webinar and participating in it with us. It's always a pleasure to work with the folks at Population Connection. So again, this webinar is in honor of, in honor, I guess, of World Environment Day. And it's only one Earth, creating lasting solutions for human and planetary well-being. Just a little bit about Transition Earth before I introduce the speakers. We advocate for a world in balance where people and nature thrive. We support integrated solutions that move us towards a healthy planet for people and the environment. Some of our programs include the PHE integrated approach, which stands for Population, Health, and Environment, which one of our speakers, Hannah Evans, will be talking in greater detail about this. But it's a way to help support empowerment of communities and help protect our planet. We also look at women's rights and youth rights and raising up youth voices on issues around reproductive health and protecting the environment and climate change. And we support and advocate for rights of nature. This webinar, again, is done for World Environment Day, which happens every year on June 5th. It's a UN officially recognized day that is meant to raise awareness about protecting our environment. This year's theme is called Only One Earth. I think most of us here on this webinar and that work on issues around environmental issues and human rights understand the idea that we only have one planet and we need to protect it for current and future generations. This slide shows a snapshot of some recent news articles that have come up in the last week or two. And if you follow the news at all, you probably see a lot of these kind of articles about how we're impacting nature, our amount of overconsumption for at least some of us on the planet. The waste that we produce, and just that it's a crisis for the planet in terms of climate change and environmental degradation. Our population is about at 8 billion people, and we all have different environmental footprints, but we need to get to a place where all 8 billion of us have our needs met and can thrive on the planet, and it's our only planet that we live on right now. So we are facing, a crisis moment where we have to figure out the best solutions that support human rights and also take care of the environment. So there's been a lot of reports recently that we're in the 6th mass extinction. And since the rise of human civilization, we've lost something around 83% of wild animals or wild mammals. And of all the mammals on the planet, only 4% are wild. And you can see that we rely a lot on livestock, and they take up a big chunk of the land mass. And just really quickly, this map is a little dated, but it shows areas of climate change hotspots where there's rapid population growth. And this map was put out by Population Action International, which goes by PAI now. And they put this out just to show, where the impacts of climate change and water stress in particular are happening. And they also looked at, in the second map, areas of where there's a great need for family planning, where women want access to contraceptives but don't have it for a variety of reasons. So yes, the time to act is now. And I just want to introduce our speakers. Hannah Evans is with Population Connection, and I don't have her bio in front of me at the moment, but you can go to Population Connection and check out her bio. And Joshua Mirondo is with Transition Earth, and he's working on raising awareness about reproductive health, in particular in Uganda, for international audiences. And with that, I will turn it over to Hannah Evans to give her presentation on population health and environment.
All right, thank you very much, Suzanne. It's always nice to collaborate with you, and hi everyone here. I am really excited to be on the call with you today, and happy World Environment Day. My name is Hannah Evans, and I work as a senior analyst here at Population Connection, which is a US-based nonprofit organization that works at the intersections of population health and environment, ultimately to advocate for increases in aid internationally, especially for family planning programs internationally. So today I'm going to be talking through some of the reasons why increasing access to healthcare and education and women's empowerment more broadly is one very necessary solution to an adaptation strategy for climate change. And just to start out, I like to give a kind of brief conceptual overview of our organization's mission. So we, as I said, work at the intersection of population health and the environment. So we really promote integrated developmental strategies that simultaneously address social, economic, and environmental issues within society. So globally, if we're looking at fertility rates and where they're highest, it's much more advantageous to kind of understand the root causes of things like rapid population growth and high fertility rates, because ultimately they have very close connections to things like poverty, marginalization, lack of access to resources, and so on. Same also goes for environmental conservation and for climate adaptation. So if we're interested at looking at different ways that we can solve climate change, and part of that has to do with things like human-induced environmental destruction, like habitat destruction or deforestation, it's much more advantageous to kind of take a holistic view, recognizing that people are interacting with their environments in different ways across the world. But that's very connected to, again, things like poverty, marginalization, the broader sort of economic and geopolitical circumstances in which they operate, and so on. So today we're going to be using a PHE approach to look at how climate adaptation and mitigation are achieved through poverty alleviation and through women's empowerment. I also always like to present this quote. It's from the UNFPA, and I think it really adequately encompasses the breadth and scope of our work as an organization. So we work to advance human rights within the context of reproductive health especially, but also education and women's empowerment. And we do this because it's obviously a necessary precursor for advancements in humanity, but also because it's very integral for a variety of other social, economic, and environmental issues within society, including things like the reduction of poverty, building climate resilience, and of course, achieving sustainable development. And a lot of our work recently focuses on the connections between population and climate change, and in particular, understanding the different ways in which humans are impacting and impacted by a progressively warmer planet. As you can see, there's a wide range of locations on the planet right now that are seeing warmer than average temperatures, and many different places that are actually breaking records for heat. This graph is taken from a recent IPCC report, which is finally and unequivocally substantiating the fact that human influence is undoubtedly contributing to these observed weather changes and global temperature increases. And the IPCC is kind of finally continuously coming out at this late stage and saying that human influence, again, is to blame for the highest concentration of carbon dioxide emissions in at least 2 million years. They're also warning that unless drastic cuts to emissions are made on a global scale, climate impacts are just going to continue to intensify. It could also, as we all know, ultimately reach a point where a great majority of the planet becomes uninhabitable. So this is obviously a very urgent problem that we need to be approaching comprehensively and using every modality that we have available. The IPCC and other international organizations that work on this effort are also very clearly stating that we still have time to avert the worst of climate change and to create a better, more equitable, and more sustainable present and future. But we have to act now. And again, we have to use every possible solution that we have available to us. And ultimately, what this is going to mean in terms of conceptualizing these really broad and sort of global scale issues is that we're going to have to understand that there are a variety of many of different complex and interconnected challenges facing the world today, most of which are of our own creation, right? So if we look historically, we can see that fossil fuel production and industrialization are very much processes that contribute to climate change and that are also putting us in danger, right? Because they're viewing, this is a framework that views growth through consumption of fossil fuels, which are causing climate change, of commodities that are causing deforestation and large-scale habitat destruction and species extinction. Also commodities like meat, which are threatening the health of the planet and humans everywhere. Lots of really sort of daunting global level issues, right? But again, what we need to recognize is that we as humans have created these processes and these incentives which are driving our world economy and causing this ecological decline, which means that we have the power to change it and to fix it and to create a more sustainable and equitable future. And so ultimately, some of the connections between population and the environment are necessary to kind of elucidate here, but I think are also pretty well known. Worldwide, we're affecting the planet in many different ways. We're destroying wildlife habitats, causing species to go extinct. We're changing the chemistries of the oceans. We're using resources at unsustainable rates, and we are contributing to climate change. And historically, many environmentalists have been concerned with the continued growth of the human population for many different reasons, but most fundamentally, I think because we know that population growth usually correlates very linearly to increases in resource use, consumption patterns, and ultimately environmental degradation. And as you can see, this has played out in many different environmental indicators around the world. So as you can see, population growth has increased in almost lockstep with a variety of other environmental issues, including most acutely fossil fuel production. And I could put a bunch of different graphs up there kind of saying the same thing. So this is ultimately something that we really need to be looking at, and we'll kind of get into the complexities of this conversation in the next few slides. But this at a macro level is true, right? So we need to kind of approach this seriously. The Global Footprint Network actually estimates that humanity is now demanding 60% more of our planet than its ecosystems can renew. But in order to maintain 85% of the world's biodiversity, which is very necessary in creating and sustaining a planet that is habitable, human demand really should only use half of what the planet can provide. So this means that current demand exceeds that goal by at least a factor of 3. And again, there are many different contributing factors to ecological deficits and decline and of climate change, of course. Certainly, we need to look at fossil fuel production and the sort of corporate influence that has created and perpetuated our dependence on non-renewable resources that are emitting large amounts of CO2 into the atmosphere. Obviously, we need to also look at consumption patterns and how they differ around the world, recognizing that inequality and geopolitics comes into play very intimately in this relationship. There's many different contributing factors, but ultimately, one of the most important factors behind this ecological imbalance is the continued growth of the human population. So we need to be figuring out ways to talk about this more openly because it is one of many different factors, but it is a really, it is a fundamental driver so long as we produce food and energy in the ways that we're doing. And there are ways to talk about it in an equitable and human rights-based way. But just to give a little bit more context for why population growth is kind of a big deal at this present moment. So if we look historically, we can see that in a very short amount of time, the growth of the human population has essentially skyrocketed. A lot of this happened following the Industrial Revolution, when advancements in things like technology, access to resources, and public health in particular helped death rates to fall significantly and our population to grow and sort of burgeon out of control. So up until 1800, it took all of human history to reach 1 billion people. Now we're at 1 billion people to the planet every 12 years, which is unprecedented in terms of growth. And so if we look at this information displayed on a map, we can see that population growth is not happening evenly everywhere. There are many places on the planet that are actually experiencing low fertility or even declining population growth rates. And this is something we can talk about in the discussion if that's interesting to anyone. But if we look on this map, we can see that population growth is occurring in some of the most marginalized places on Earth. Most of Africa, in particular sub-Saharan Africa, parts of the Middle East and South Asia, parts of Latin America, and so on. And so this also means, and this is an important distinction here, that population growth alone is not the sole or #1 contributor to large-scale environmental degradation of any kind, including that of climate change. If that were true, that logic would somehow indicate that the poorest populations, many of whom are making less than $2 a day, are contributing the most amount of environmental harm. Of course, we know that this is not true, but it is a really dangerous oversimplification that has been used before, and it's simply just not an accurate statement. But if we're, interested in kind of looking at, what climate adaptation is going to mean, what resource use and distribution is going to look like into the future, understanding where populations are going to grow the fastest into the future is really helpful, right? So this information kind of depicts exactly that. It's based off of the UN's medium variant projection and shows where the majority of the population globally is going to occur. And there are many different places that actually experience really high fertility and low economic status, which is the kind of focus of the rest of the presentation here. But there are also many places on the planet that are experiencing large-scale population growth alongside large-scale economic development and growth. And again, unless we change the way that we're producing food and energy, this is a real focal point for us as we are kind of teasing out the connections between the environment and population, and really comes into play, especially if we're looking at climate change. But overall, in a global context, we can see that there's a direct correlation between the level of development within a country, economically speaking, socioeconomically speaking, and population growth rates. So as you can see, the quote unquote more developed regions, the industrialized economies that have already gone through the process of industrialization and increased affluence and standard of living, have a much lower population growth rate than the rest of the world. And in particular, in comparison to the least developed countries, which have the highest population growth rates in the world. In fact, many least developed countries are going to continue to experience rapid population growth between 2019 and 2050. Largely, this is a reflection of poverty and lack of access to resources and no access to women's empowerment overall. But this comes into play not only socially, but also environmentally, because in a climate change context, this means that more people are going to be experiencing climate risks who lack the ability or capital to readily respond or recover. This is also very much a climate justice issue because these populations have not contributed hardly anything at all to the climate crisis that they're now experiencing in more severe contexts than anyone else. So there is a direct correlation between fertility rates and poverty. So as you can see on this map, there's places that are considered marginalized, who lack access to resources and who are in sort of low income situations in the process of industrializing or pre-industrial, have some of the highest fertility rates and the highest also unmet need for contraceptives. So in these contexts, if countries are trying to develop economically and environmentally, population pressures put a lot of challenges forth with regards to resource allocation and localized environmental degradation, food production, economic growth and development, access to education, and so on. According to the UN, the world's 47 least developed countries are also the fastest growing. So this also comes into play with what's called climate vulnerability. So many countries in sub-Saharan Africa, which again are growing the fastest, are projected to double between 2020 and 2050. And again, this really increases strain on already scarce resources and slows progress in health and economic growth. As you can see here, 9 out of the 10 most climate vulnerable countries are located in sub-Saharan Africa, which again is projected to double in population by 2050. Some of the most affected countries are also acutely aware of this challenge. So the UN offers the opportunity for different countries around the world to submit what are called NAPAs, or National Adaptation Programs of Action. And they do this as a way of assessing their various vulnerabilities within a climate change context within their country, and as a way of receiving aid in return. And I'm bringing this up because out of the first 40 NAPA submissions, 37 countries identified that population pressures were a factor that were increasing vulnerability and making it harder to adapt to climate change. And yet there's been very little integration of family planning or education into climate solutions or climate funding. So just to kind of wrap up this concept, if in low-income regions that are growing really quickly alongside high climate vulnerability, population pressures really increase already sort of strained resources and create a condition that is unfavorable in terms of sustainable development. In contrast, investments in sustainable development, especially those of education, healthcare, and women's empowerment, will help build resilience and adaptive capacity for all populations around the world, especially those that are most vulnerable. Within these solutions is a really direct need to increase access to family planning services and make sure that funding is available for all populations and organizations around the world that are facilitating the service. One of the reasons why this is very important is because gender inequality really intersects with climate change in ways that threaten the health, livelihoods, safety, and security of women and girls worldwide. So the world's women and girls are disproportionately impacted by climate change. They are more likely to leave school because of climate disasters. Child marriage is increasing alongside that of unpredictable and prolonged droughts or rainy seasons. They are more impacted by climate disasters in general, and are therefore most at risk with regards to climate change. This is one reason why it's absolutely essential for women and girls to actually access the resources necessary in order to adapt to climate change, much less, be equal within society. Reproductive health is also something that's greatly impacted by the climate crisis. So, access to reproductive health care is one of the first things to go during climate disasters, and can materialize in many different ways, including increases in infant and maternal mortality, less access to comprehensive health care, which will allow them to adapt to climate change, increases in unmet needs for family planning. There's recent research looking at the relationship between the climate crisis and unintended pregnancies or unplanned births. So, the relationship between the climate crisis and reproductive justice is very intimate and intertwined. So I'm going to spend the rest of the presentation just kind of looking at the solutions that can be put forth by increasing access to family planning and health and education. So one reason why family planning represents such a compelling solution to climate change, but also to social and economic growth, is because it covers a wide variety of these issues. So there's myriad benefits to society that are afforded through voluntary family planning and reproductive health care. So fundamentally, it facilitates what's known as informed choice, which enables women and couples to freely and responsibly determine the number, timing, and spacing of their births. And as you can see also from health and social, economic, and environmental perspectives, it also yields a variety of different benefits. From a climate change perspective, over time, the impact of reducing unintended pregnancies means slower population growth, which lessens climate vulnerability, and puts less pressure on localized resources, especially in terms of things like food production, access to natural resources, and so on, like potable water. In addition to family planning, it's really advantageous for us to look at the advancements put forth by education. So education is usually coupled with family planning services whenever we're looking at climate change solutions in a social context, because they complement each other and they also co-constitute one another, right? So it's just as important that women, men, boys and girls are educated, right? That will allow them to better sort of prepare themselves for climate impacts. It will allow them to confront cultural barriers that might otherwise prevent people from utilizing an advantageous resource like that of family planning. And ultimately, it facilitates development in all aspects of society. And this is because whenever education levels rise for women and girls, they gain power. They gain social, economic, and political power. Higher levels of education afford more options for sustained employment and the increase in livelihoods. This frees up resources to help women and girls choose when and how to start a family. And women who are educated tend statistically to have fewer, healthier children. This is the trend that we see all around the world, especially in the more industrialized places that are seeing lower population growth rates. A lot of this has occurred because of advancements in health and education and because of a more equitable foundation, societally speaking, for women in comparison to men. As you can see, there is a direct correlation between women's educational attainment and children per woman. So the more education that women have, the later they're marrying, the less kids they're having, and the children that they're having are better educated themselves and also healthier. Worldwide, this is a problem because, as Suzanne mentioned, there are many different intersecting issues that kind of compound the present challenges that we're facing with regards to things not only like climate change, but also the pandemic. So there's a confluence of sort of inequalities that span climate vulnerability, lack of access to education, and high unmet needs for family planning, which means that some of the most at-risk regions throughout the entire world are experiencing the effects of the climate crisis, which was not caused by these populations, in the most severe sort of ways. This is something that affects all of us ultimately as a global community, and something that we can work to confront through integrated solutions that are simultaneously addressing all of these different issues. There's plenty of research out there that's looking at the kind of the effects that meeting women's needs for family planning and reproductive health have for climate adaptation. And, you know, very simply, increasing access to healthcare is a really fundamental driver of climate adaptation, especially for women and girls. That's because whenever they're healthier, women, you know, that's a fundamental aspect of building climate resilience. It allows them the time and the resources and the wherewithal to become empowered to engage in climate adaptation efforts. Over time, you know, access to family planning and reproductive health reduces the rate of unintended pregnancies, which results in smaller families and a reduced demand for climate sensitive resources. And ultimately, this kind of coalesces to form slower population growth rates, which lessens pressure on local and natural resources and exposes fewer people to climate risks. In terms of climate mitigation, advancements in health and education are also very, very compelling. So this is research that was done by an organization called Project Drawdown, which is constantly assessing different climate solutions based off of various indicators like upfront cost, return on investment, and so on. As you can see by looking at this slide, they have identified that meeting the global unmet need for family planning and educating girls could result in emissions offsets of up to 85.4 gigatons of CO2 just by 2050 alone. As you can see, that means that it's ranked in the top 5 global solutions in terms of, again, upfront cost, return on investment, and potential emissions offsets. This is just a graph that was replicated, or a chart, excuse me, that was replicated based off of the kind of the same information. So this organization ranks different solutions based off of scenarios. The scenarios are in line with what would be needed to abate global temperature increases by 1.5 degrees Celsius or 2 degrees Celsius based off of the Paris Climate Accords. And they've ranked health and education second out of, I only have like 10 or 11 listed here, but second out of 82 different solutions, again, in terms of its sort of holistic approach to abating climate change and for the climate mitigation aspect as well of emissions offsets. So again, not only in terms of human rights and social justice and climate justice and everything else, but family planning and healthcare is also very integral for climate mitigation as well. This is not the first, reason why we're doing this, but if we're looking holistically and comprehensively at the problem that we're facing, this is something that needs to be included as a climate solution as well. And it's something that can be done by advancing human rights. So in my opinion, it should be one of the most sought after and urgently implemented solutions out there. And so that's, as an organization, what we work on. And internationally speaking, right now, there are 218 million women who want to avoid pregnancy, but are not currently using any modern form of contraception. This ultimately ends up meaning that there are 111 million unintended pregnancies annually that occur in LMICs alone. In contrast, if all women who wanted to avoid pregnancy in these regions were able to use modern contraceptives and receive the care that at the levels recommended by the World Health Organization, the impacts would be enormous, right? There would be a drastic increase in unintended pregnancies, about a 65% reduction in unsafe abortion, and a drastic increase as well in maternal deaths. So this is, again, something that's really necessary for saving lives, for creating a more equitable and sustainable future, and for advancing women's empowerment and women's rights as well. So a lot of our organization focuses on the funding that's necessary in order to meet these needs globally. And currently, with all of the different contributions, including that of the United States, we still have a $5.5 billion funding gap for fully meeting the unmet needs globally for family planning. The United States is consistently the biggest contributor of aid, but it represents a really tiny fraction of our budgets and is constantly under threat because of the very partisan nature of family planning. So this is something that we really work to further institutionalize and secure as a way of meeting population health and environment needs throughout the world and promoting a more sustainable future. So just to conclude here, we advocate for expanding family planning and reproductive health care as a critical element of women's empowerment, and also something that can really play an important role in climate adaptation and mitigation efforts. Again, slowing population growth through rights-based innovations like voluntary family planning and girls' education can mitigate climate change by offsetting emissions in the long term. And is also just a really fundamental aspect of meeting human rights and social justice standards. It's also a very important building block for resilience to climate change and for adaptation as well. And also something that, in our opinion, deserves a lot more funding, right? So it receives about 1% of all overseas developmental assistance, but it is one of the most cost-effective investments a country can make, all things considered here. So with that, I will turn it over to Josh, and I look forward to a discussion afterwards. Thanks, everyone.
Thanks, Hannah. And while Josh is getting this presentation up, I just want to say you give such an informative presentation in a really succinct amount of time, and you hit upon that last point about 1% of overseas development assistance going for family planning is really mind-boggling that, it's such a small amount, and there's so much we can do with just a little bit more to meet the needs of women and men around the world.
Yeah, absolutely. And it's something that, again, is highly partisan in the United States as well. So it's really under threat and really inconsistent. So depending on who's in power, whether it be a Republican or Democrat, that can greatly influence whether or not an organization receives aid or the conditions on which an organization receives aid. And ultimately, because limitations are set forth in such varying and extreme ways, organizations may, have no option but to not receive, no other option but to not receive US funding whenever limitations are in place, which means that, organizations that are providing life-saving services, in addition to just family planning and reproductive health more broadly, can't do that every 4 years or every other 4 years or something. So it creates like it really stifles progress ultimately, and has a direct impact on people's lives. And by people's lives, I mean some of the most marginalized, sort of low-income populations around the world. So there's really no excuse for this, and it needs to be further institutionalized. I don't want to take too much time up talking. I'll let you go, but yeah.
Thanks, Hannah. Well, as Josh is hopefully able to share his screen, I'll just say again that Josh is a communication specialist and a photographer, and he's been working with me at Transition Earth for a couple years now, off and on, and he's very passionate about sexual and reproductive health, especially as it pertains to young people. So I look forward to hearing his talk about what's happening on the ground in Uganda.
Yeah, thank you so much, Susan. I don't know if you can hear me clearly.
Yes, we can hear you. Go ahead, Josh.
Great. My name is Joshua Mirondo, and I don't want to do a lot of introduction because Susan has already done that. First of all, happy World Environment Day, and I'm glad to be here. I work with Transition Earth, and I've been collaborating with them for quite some time, and I'm glad to, I'm honored to be one of the presenters for today. So I'll be sharing the status of reproductive health in Uganda vis-a-vis climate change. As we go on, I will try to dissect how both of them are affecting lives and how both of them are linked together. First, I will first talk about the status of sexual reproductive health in Uganda. I know how all of us were affected by the global pandemic. So we realized that in Uganda, we have been facing quite a number of reproductive health challenges. However, we're trying to make, I can call them steps. I was going to call them strides, but then I realized that we're making quite a number of steps. The unmet needs for family planning had been narrowed down for accessing family planning, for accessing SRHR information. People were organizations and the government were trying to put mechanisms in place to ensure that people have access to reproductive health services and information. But this is when the pandemic came. So we were, at the end of the day, we realized that the pandemic, let's say the pandemic is still going on, but then lockdown was lifted in Uganda, but the results that the COVID-19 pandemic left in Uganda will last more than the time that we really suffered the intense lockdown and the COVID-19 pandemic. So we had tried to make some steps, but then it came. So during the COVID-19 pandemic that just hit Uganda, we witnessed a high growth in teenage pregnancies. We witnessed high rates of gender-based violence in homes. Most times, the girls in Uganda and boys, I can say children in Uganda, spend most of their times at school. Some of them are in boarding school. Some of them go for normal classes, and then after they go for remedial classes. But when the pandemic came, schools were closed, and most of these people were caged into homes which they were not used to, and that's why there was a spike of teenage pregnancies and gender-based violence. So these people are not used to being with each other, and then here they were, all of them locked down. They were not able to move from here to, from one place to another. They were not able to, in case of their rights have been violated, they were not able to report. There were no transport means, and if they got you using a car when you're not one of the essential workers, it was an arrest. And even if they just got you using either public means or private means, it was just an arrest. Even if you're using just these other, we have what we call border the motorcycles. Motorcycles are used as public means in Uganda. So if you use them, you would also be arrested. So the pandemic really brought a lot of challenges to us, regardless of the strides that have been made. So in the first 6 months, of COVID-19, over 860 girls got pregnant. The cases of gender-based violence rose up. So how you can see on the screen, the gender-based violence cases shot up from 2,386 in 2019, that was before the lockdown, to 8,203 when the lockdown came up. And these are reports. This is a report from the Ministry of Gender in Uganda. And then the victims of gender-based violence also increased, as you can see on the screen. So the state of SRHR in Uganda, it wasn't very good. However, it was made worse as the pandemic hit. So post-lockdown, now, like I shared earlier, what is happening right now after the lockdown measures were eased, because at the start of the year, in January, early this year, around 10th January, schools were opened, and then before COVID-19 hit the country, they never accepted teenage girls who are pregnant to go back to be in school. Whenever you got pregnant and you're a teenager, they always told you to kindly step away from school until you give birth. If you're able to come back, if you're not able to come back, they can't do anything for you. But this time around, when the schools were opened after lockdown, the government passed, the Minister of Education passed an order that pregnant girls should be allowed back to school. Why did this happen? Because the situation had gotten worse. It was really so bad. But we hope that different actors will come together and ensure that the teenage pregnancies really go down. But then recently, it was yesterday, the Minister of Health, she's called Honorable Jennifer Cheng, she announced that we need to be careful because COVID is spreading again. So we don't know whether they're going to take us in another lockdown. But it is it is like that. So we're still, even if the lockdown was done, we're still experiencing effects that were brought by the lockdown as a measure of controlling COVID-19. So then also when the pandemic came into play, the health sector forgot about any other kind of approach to the health well-being of Ugandans. All of them focused their monies and all their energies onto ending COVID-19. And then people who are affected people who are on ART, that is antiretroviral treatment, on the treatment on HIV, could not access the medicine. So many of them ended up becoming sickly. And then we got drug stockouts because of they had transportation. The value chain of medicine ended. Even if you're talking about teenage pregnancies, people still got pregnant, those who are not teenagers, because they could not access contraceptives because of the lockdown. So the effects, the number of the population increase during lockdown is so outrageous, whereby we are really going to live with it. COVID-19 and beyond, even by the time when they declare that COVID-19 is done, we are going to still stay with those effects. So We also found an increase of mental health issues during this time. Like I told you, lockdown affected us, but then even post-lockdown, we are finding very many people are having mental health issues, and the government and other organizations are coming up to put up measures that help people to control or curb the mental health issues. And then there's a lot of pressure on maternal health due to increased numbers, especially of first-time mothers. So, like I said, there are a lot of teenage pregnancies. Even those who are not pregnant ended up getting, those who are not teenagers end up getting pregnant because of drug stockouts and maybe limited access to contraceptives. So there's a lot of pressure on the maternal health services due to a lot of increased numbers, because our facilities are not that big. Even the big facilities, since the population is increasing rapidly, we find that the ratio of a nurse to a patient is 1 to 1,000, and that is why some people are opting to go to private clinics, and then some of the people can't afford the private clinics. They have to go to the public hospitals, and then they cannot afford them. So sexual and reproductive health in Uganda was greatly affected by by COVID-19, and that is why I really wanted to start from there, just to give you a highlight of we had fought a good fight, but then the pandemic really made us, actually we had moved 5 steps forward, but the pandemic made us move 100 steps backwards in regards to reproductive health in Uganda. Yeah, so after all this happened, various stakeholders, the government, civil society organizations came up with means to make sure that the vast effects of the pandemic are being controlled, because already we had existing issues on sexual and reproductive health, but then the pandemic had made them worse. But then we asked ourselves, how can we move forward? The stakeholders asked themselves, how can we move forward? So people ended up becoming creative and innovative, and one of the innovations people are moving into in making sure that young people can access contraceptives even without necessarily having to be somewhere. For instance, the first example I gave, digital innovations in ending teenage pregnancies. I will share an article that details this, because I got an opportunity to work with an institution that is making sure that young people access contraceptives through a digital service. It's called TICO. This is used in a way that a young person, a teenage girl between 15 to 19, just needs to have a card. And then they are enrolled onto a system, the system called TICO, and then they access free contraceptives. It's an initiative by an organization called the African Foundation. Then they're also establishing GBV shelters, gender-based violence shelters. The shelters were there, but then the numbers in the existing shelters, gender-based violence shelters, were so outrageous during the lockdown. Those who managed to get there really got there because they had to escape being tortured by their husbands in homes or being tortured by their parents in homes. So gender-based violence shelters are being established to make sure that people are really safe, because you cannot keep staying with your abuser. And then there's a lot of laxity of the law, whereby you can report someone for abuse and then they kind of walk away or bribe the systems. That is what is happening right now. Mental health awareness is being various CSOs and even the government, they are creating programs to ensure that people's mental health is really in check, is put to check. Then there's a lot of information dissemination. On now during all this time, we are passing out information on how to end teenage pregnancies. We are passing out information on gender-based violence, how to report when you're affected. Then we are doing gender mainstreaming, how to involve men and boys right from the grassroots to ensure that as they grow up, they grow up to respect women and girls, because most of the perpetrators of gender-based violence are men, and the victims are mostly women and girls. I cannot say that some men are not affected by gender-based violence. They are really affected, but the greatest percentage that are victims are the girls and women. That is why we are carrying out what is called gender mainstreaming, where we bring men and boys on board, and we focus mainly on boys because we want them to grow up knowing that they need to respect women, and for the men, we want them to understand that women are also human. Women are also people whom they can sit and share ideas with on the table. Then we also have the government intervention on the District Integrated Committee on Adolescent Health. These are established in the various, they're established by the government in the various districts, and then for the bigger districts, we have divisions. Each division has a district integrated committee on adolescent health. Now, this committee has around 25 members, and each committee has an adolescent girl and a teenager. Then it has a local leader. So these seats, they usually sit per month to discuss how best to integrate adolescent health in the programming of the division and the district at large. Just a minute. Yes. Now I want to talk about climate change and reproductive health. So many people, usually those who are climate change activists, they focus on climate change, and those who are reproductive health activists focus on reproductive health. But then the two, climate change and reproductive health, are inseparable, and both of them should be given the same attention. None of them should be separated from the other. Why? Just like the quote I put, climate change is one of the most disruptive issues of our time. Not only is it a disruptor towards development, but it's also a multiplier of existing health and vulnerabilities among and in gender. So this was by Dr. Julita Onabanjo, the regional director of UNFPA in Eastern and Southern Africa. So what I was trying to say is we need to give climate change a lot of attention, because it directly affects and makes people vulnerable. It makes people vulnerable. For instance, young girls are unable to attend school if they are displaced. For instance, they risk being married, and then their parents can no longer afford to look after them since they have lost their livelihoods. So this happened in Uganda in 2020. When people were in lockdown. I don't know what the cause was, but there was a rise of water levels on River Nile. Yeah, those who don't know, I'm blessed to come from a country that has the source of River Nile. Yeah, the longest river. Yeah, so River Nile flooded in an area called the Albertine region. It's in West Nile, Uganda, northern Uganda, but then we have an area called West Nile. So people's homes were submerged in water, schools were submerged in water, and even the markets. So people had to be displaced, and they had to be taken to camps. Those who could not get alternatives of where to stay, they had to be taken in camps. And then when they were taken in camps, you know, the life in internally displaced people camps is not so easy. They usually put the same shelter, and then there are like 5 families. So a lot happens there. There's a lot of gender-based violence there. There's rape, there's battering women, and a lot of things. Then also, when schools resumed, most of the schools that had been submerged in water, the structures were not they're not best placed to take on education again. They needed renovations, and then it could not happen on time. So most of the people who could afford going to those schools, they could not afford to go to other schools, maybe distant places. They could not continue with school, especially girls. And most of the girls, when they fail to continue with school, they will end up engaging in small activities, maybe to earn a living, and that's how they get pregnant. So this is how climate change is really affected the people of West Nile, Uganda. And then Also, when the areas were submerged in water, there was limited access to health services. And then, for instance, when the water submerged the Albertine region of the West Nile, people were not able to get health services, because even one of the health center for was submerged in water. So we realized that people could die of preventable diseases. Then people who are living with disabilities are not usually helped. They're usually left out, because when the flooding comes, they're just left out there, and then access to some of these facilities is so hard for people living with disabilities, because maybe they need to walk long distances, and then some of them are handicapped, some of them have a vision impairment, others can't talk, and then we have not yet integrated people living with disabilities health so much in the different health sectors. For instance, it's so hard to find a Ugandan hospital having a sign language interpreter. It's so hard to find a Ugandan hospital that really takes care of the blind, a specific person who is in charge of people living with disabilities. It is really, really hard. Some hospitals have tried, they have tried to manage that, but it is really hard to find in Uganda. Then young women and girls usually give up on their aspirations due to climate change. In life, just like what I told you about, schools have been submerged in water, and then they feel like they cannot proceed with the school. It's more like a disruptor. The number of children who went back to school after lockdown were really limited. And now if you relate this to how climate change affects, this happens in the disastrous where disaster happens. The instance, the example that I gave in the Albertine region of Uganda, when the disaster happens, schools have been submerged in water. These girls usually lose focus, and they stop concentrating on maybe education, so they end up taking part in other small activities that will make them give up on their aspirations as they take lifelong non-profit jobs. So then also gender roles. Due to gender roles, women are often dependent on natural environment for subsistence and income. And when there is a change in climate, it affects women more than men. So in very many families in Uganda, women are the breadwinners. And then women being breadwinners, they focus on subsistence farming. So it's more like a hand-to-mouth approach, of a hand-to-mouth way of living. So when climate change comes, they will not be able to do the farming, because farming is more like the base, what most women in, for instance, in rural areas survive on. So when climate change comes, drought comes, sometimes it's not drought, sometimes the heavy rains, and the places end up flooding, the crops get spoiled. And remember, they have a lot of children. In Uganda, an average woman gives birth to 6 children. And then how is this lady going to look after the 6 children when even the garden where she was depending on has been flooded, or it has been affected by drought? So that is basically how climate change affects reproductive health. And then if you go back to women being breadwinners and then depending mainly on subsistence farming, some of them end up becoming, maybe I can say, sex workers, because they have to help their families. And then in some areas, when the young girls see their mothers becoming sex workers, they might also they also take up the role. I know some areas that really have very, very, very young commercial sex workers, and then their parents are nowhere to be seen. They cannot be coming out stopping their girls from that. So now this is how climate change and reproductive health affect each other. But then now, what are the lasting solutions to climate change and reproductive health? So we realize that we have policies on sexual and reproductive health, and we also have policies on climate change. We were so lucky that last year the parliament passed the bill on climate change, and then this bill on climate change meant that schools have to integrate climate change in in their curriculum, and then also spreading out of this information is really low, because right now if you just sample one Ugandan and ask them, have you ever heard of the climate change bill, they will say they've never heard of it. So we need to strengthen these policies and make sure that they go out to several people. And then we need to integrate, there is integration of reproductive health and climate change in all sectors. However, it is not as grounded enough, because this the policymakers in Uganda know that reproductive health affects climate change, and yes, they are trying to put down things to ensure that these two are really taken care of. However, it is not as strong. It's not that people are not giving it priority. Now, the government finances the military more than it finances the health sector. So, and then the environment is not focused on so much. People are stealing. People are still cutting down trees illegally. People are reclaiming swamps, burning bushes, and then because they don't have information that is enough, so the government and other civil society organizations are also using media as a tool to advocate for climate change. However, more needs to be done. I'm not saying that there is nothing being done. These are some of the solutions that are being done. However, it is really not enough. A lot needs to be continued in regards with using media as a tool, because the TVs have ads, the radios have ads, the newspaper, on social media, different platforms on social media, on webinars like this, they're trying to use media to advocate for climate change. However, more needs to be done. For instance, I've seen several conferences on climate change, and I've seen several conferences on reproductive health. However, now we have to go to the grassroots. We need to go to the grassroots for people who cannot afford the internet, for people who cannot afford to go to these conferences, for people who cannot afford to be on a webinar like this. They need to get a lot of information. Yeah, so my call for action is that the health sector should ignore climate change. There's need for information dissemination from the grassroots, and then everyone has a role to play. It shouldn't be left to organizations and governments. So many times when we are talking about reproductive health, when talking about climate change, many people think that it's supposed to be only and only organizations and only the governments to talk about climate change or reproductive health. No, it should be everyone's role. If you can talk to two people about climate change, if you can talk to two people about how they can control population, if you can talk to two people how they can reduce on how often they have risky sexual, they engage in risky sexual behaviors, please do that. We should not leave it to only population connect. We should not leave it on to transition Earth. Let all of us be each brother's keeper. Let all of us ensure that we take part in this. Everyone has a role to play. Thank you so much. That's all I had. I think I'll take back the microphone to Suzanne. Thank you.
Thanks so much, Josh, for that really fascinating presentation on what is happening on the ground in Uganda. It's, the impacts of climate change sometimes seem far away, especially for those of us in, the developed world. But, even here, we're experiencing more and more impacts, but definitely in Uganda and in sub-Saharan Africa, you've been experiencing those impacts for some time now. And really, access to reproductive health is part of the climate adaptation strategy that Hannah talked about, that we all need to understand better and certainly get it out into the media. We are just after the hour, so I think maybe with that in mind, there's one question I think that is really pertinent to this whole presentation and many more. And people want to stay on, we can try to ask or address a couple of the other questions, but why don't we tackle this first one? And it's someone had sent this in earlier before the webinar started, and she wants to know how do we talk about population issues, especially those of us in the United States or in developed countries, that doesn't make us sound like we're racist. I mean, those of us here on this webinar, I'm sure we all support, women's rights, youth rights, get men's rights. We want everybody to have access to reproductive health, and we want to protect the earth. But sometimes when we talk about these issues, it's misunderstood that, it makes it seem like, we're pointing the finger at somebody else, which has been a long, long history in the population issue. So Josh, in particular, I'm curious, being in Uganda, a country that's coping with rapid population growth and everything you talked about in your presentation about gender violence and mental health and climate change. Do you have any thoughts on this idea of talking about population? How do we get past this racist threat or connotation and get people to understand that we really just care about getting access to healthcare, clean water, healthy foods, nutrition, sending our kids to school and so on, without it being misunderstood? And then Hannah, maybe you can pipe in if you have some thoughts after Josh.
When it comes to Uganda, and what I've had an experience on is, I can't say we have racism in Uganda. I can't say you have racism in Uganda, but generally, what I just want to say is that this is not racist, because it affects everyone. It affects all of us. Like what I said, if they establish an industry in China, and the industry is releasing a lot of dangerous fumes into the atmosphere and then destroying the ozone layer, it won't affect only the Chinese, right? It will affect everyone. And then same as population. So the more the more the population increases, and then the more we increase our pressure on the land. And then you realize that one of the reasons why COVID-19 spread so fast is because of the population increase. And then aside from Asia, where we find that countries have a lot of people. So there was a fast increase in the spread of COVID-19, and it wasn't because of anything else, but some of them is people's reluctancy and then population. So if we say that population control is racist, we are really doing ourselves a disservice, because it doesn't affect one race, it affects all the races. So let us just join hands and then stop saying that it is racist, because it doesn't affect only one, it affects all of us. And that's why when I was concluding with my presentation, I said it is a role of everyone to play, everyone in their capacities. However young you are, however old you are, in all our capacities, we have a role to play in making sure that we control the population. Yeah, thank you so much. I don't know if I've answered.
Thanks, Josh. No, that was really good. Yes, we all definitely have a role to play. Hannah, you have any quick thoughts on this question?
Yeah, no, I think that you put it really well, Joshua, and it's about recognizing that this is a global crisis that affects everyone, and that we as a global community are collectively facing. So that also means educating ourselves about how our impacts on climate change differ according to various indicators, and really paying attention to the pernicious history of population policies that have wreaked havoc on our planet in both historical and contemporary contexts. It's very important to be careful about the language we're using, to really understand kind of all of the different factors that come into play, not only with population and the environment, but also with inequality and geopolitics, histories of colonization and imperialism and things like that. It's a really complex topic that needs to be approached in a way that is nuanced, right? That said, I think that there are ways to do that. And if we're able to, work collectively to kind of confront climate change in this way that upholds human rights, then that will be the most effective and, equitable way forward. Mhm.
Thanks. Yeah, I think, we have a lot to learn from one another. So it's a lot of listening and learning involved in education just across the board on a variety of issues, and just raising the voices of people around the world, and in this country as well, so we can get past, all the rightfully so negative parts of the history of, population issues, but, put forth the solutions that we know that work, that are integrated and support equity.
Mhm. Yeah, I'd like to just take a quick, just before we sign off, could I address Nelson's question? Because I think he's raised a couple interesting points and some things that are really relevant to this discussion. And so Nelson asks, if bringing women out of poverty and increasing education results in higher consumption rates, then will that ultimately result in environmental degradation at large scales? And this is also kind of a common argument that's put forth to kind of complicate the role that increasing access to resources plays in environmental degradation. But it's really important to understand whenever we're talking about these global issues and the ways in which population growth intersects with the environment, that population growth is one aspect of a much larger problem. And this is something that I tried to relay within the presentation, but climate change has been caused by industrialization, by a dependence on fossil fuels, by industrialized agriculture, and by an economy that is consumption-based, that values economies of scale types of production, and the consumption of cheap, non-renewable, non-reusable goods that are petroleum-based. This is all a very systematic approach to the way that our world works. So abating climate change requires changing the way that we produce food and energy. No doubt, like that has to happen regardless of population growth. That will allow consumption rates to become higher and people to be able to better their standard of living without further contributing to ecological decline at such drastic scales. And research again shows, and I put this in the chat, but research shows also that even within countries, there's huge disparities in wealth in that, the world's richest populations, people all across the world in any country that are making over $100,000 a year, they are contributing an overwhelmingly disproportionate amount of CO2 into the atmosphere relative to anybody else. Because of that, research is showing that, even bringing hundreds of millions of people out of poverty, these are people making less than $2 a day, that would raise the CO2 emissions globally by less than 1%, and that is true. He brought up China as being a really big contributor to CO2 emissions, and that is true, but also this is a nuanced conversation because China has industrialized and to produce a huge amount of goods that are consumed elsewhere, right? So they've contributed CO2 emissions into the atmosphere because they're selling goods that we're consuming. They've done this on very, very cheap labor and a low sort of economic framework overall. This is changing now, as you've mentioned, and that's right, but these conversations need to kind of include all of these different aspects. Then why don't we talk about reducing the environmental footprint of the wealthy? Very good point. I think that that's another huge part of this. We have to reduce CO2 emissions and carbon footprints in the world's most affluent regions. Absolutely. This is something that we cannot solve climate change without. And within the domestic sphere, access to reproductive rights really does impact, not only human rights, but also the environment in ways that are really, really impactful. And so that's why we work on reproductive rights domestically as well, to make sure that everybody has access to the resources necessary in order to reduce their carbon footprints and choose the number of children that they want to have. Our organization in particular focuses on the ways in which health and education and advancements in women's empowerment can influence climate change in positive ways. That's not to say that that's like the be all end all solution and that that's the only thing we should be talking about. that's our focus, as well as like education about why this is necessary. So I hope that provides a little bit more clarity, and I know we're getting a little bit over time here, but I wanted to make sure to address Nelson's comments because they're important. So thanks for bringing them up, Nelson.
Well, thanks, Hannah, for addressing those important points. And thanks everyone for your questions. And I'm sorry that we have run out of time to address all of them, but we'll review them and maybe that can be a future webinar, who knows? And I want to thank Hannah and Josh in particular for your presentations. It's so interesting and much to think about. And again, thank you to Population Connection and Stephanie for her help in getting this up and running. So thanks, everyone.